As you know, radium-223 is just one of those approved agents for patients who have symptomatic castration-resistant prostate cancer, skeletal metastases, no visceral metastases, all these only small lymph node metastases located in the small pelvis. The idea of this paper was, or the idea of this study was to analyze if the earlier use of radium-223 could have a benefit in terms of treatment outcome in those patients. And what we have seen, if patients are treated, if they have asymptomatic skeletal metastases, the median overall survival was significantly longer as compared to those patients who have symptomatic disease. We could show that the median duration of response was significantly longer, and we also could see that the development until pain is extended to quite an extent, so that patients would benefit from the early use of radium-223. So the bottom line message would be you could use it based on the scientific data. On the other hand, it's not approved for asymptomatic patients, so at least we cannot use it in daily routine. But just demonstrating that all these life-prolonging agents should be used as early as possible. I think if we really look at patients who have mCRPC by conventional imaging, but consider those who have these very rapid PSA doubling times of around 6 months, we know that all of those patients will have metastatic disease, microscopic metastatic disease. If you would use a PSMA PET-CT, we see they have metastatic disease. So first of all, I think this mCRPC is an existing status of the disease. I think that early treatment has significant benefits to the patients because we know once patients develop metastases, they have a very short overall survival time, at least considering the short PSA doubling times. We know that the development of skeletal metastases, which is the major localization of metastatic disease in CRPC, is associated with significant symptoms. Significant symptoms are associated with a reduction in overall survival. So in my view, just selecting those patients with rapid PSA doubling times, active treatment is very effective. And if we just look at the ARAMIS study, which was presented today, we also see that there is already an overall survival benefit. So I think early use of these life-prolonging agents is quite important to prolong the overall survival with treatments with less toxicity than the traditional approaches.